In a little over a week, Pfizer may receive permission to distribute its COVID-19 vaccine. But what happens then? Who gets the vaccine first? And who has to wait? KCTV5's Amy Anderson is covering a meeting that will go a long way toward answering those questions. Amy?
Well, Brad, as expected, those on the front lines will be first in line. The committee's recommendations will now go to each state so that they can get their rollout plans in place. In pure 2020 fashion, those deciding who will get the vaccine first were forced to meet via Zoom. Doctors discussed implementation among high-risk groups centered around healthcare workers and those in long-term care facilities. Both Pfizer and Moderna have asked the FDA for emergency use authorization of their 2-dose vaccines. Initial doses will be limited, with about 40 million doses, enough to vaccinate about 20 million people by the end of December. The country's 21 million healthcare workers will go first. As of Monday, there were 243,000 confirmed COVID-19 cases among workers and 858 deaths. The nation's 3 million long-term care facility residents are also at the top of the list because they account for 40% of COVID-19 deaths. Most on the committee were comfortable moving forward with vaccinations for some of our most vulnerable, but not all.
I remain a bit concerned about including residents of long-term care facilities in the 1A group because of the lack of both safety and efficacy data.
Each state will now develop its own rollout. Here at home, the Missouri Department of Health and Senior Services says it expects to have 50,000 doses in the next 2 to 3 weeks. Kansas has a plan in place as well, one the CDC gave a thumbs up to last week. Dr. Kevin Alt with the University of Kansas Health System is one of the medical experts on the advisory committee on immunization practices. He, along with 14 others, are the ones tasked with deciding who will get the potentially life-saving vaccine first. It'll still likely be late spring or even early summer before young, healthy adults and children will be included, but their time will come as well. As for cost, it's likely to be free for anyone that wants one. It is important to remember that the first 2 vaccines we'll likely have will require 2 doses a few weeks apart. Medical workers will do what they can to make sure people come back in time for their second dose, but it's definitely something we will all need to be mindful of. Amy Anderson, KCTV5 News.
Boy, a ton of information there. Thank you, Amy.